Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. I want to thank you for joining us. FYI, the Quincy Health Department looks at health issues and health concerns and helps you to stay informed. Today's topic, conscious choking. Joining me, as in programs past, is Ruth Jones, the public health nurse educator here in the city of Quincy. Ruth, welcome back.
Thank you, Mark. Good to be here again.
Great to have you. This topic, conscious choking, one that I think you and I suggested we cover even a while back. We've done so many different topics through the years. It's kind of a surprise that we haven't done one on choking.
Right, and it's such an important topic, and hopefully after people see the show today, they'll feel a little bit more comfortable if they get into a choking situation, whether they're at home or out in a restaurant. So hopefully this will be a very helpful show for them.
I'm sure it will be. As we normally do, I'd like to go over the outline for today's show. Number one, we will start with what is conscious choking. Causes of choking will be next. Mild blockage after that. The Heimlich maneuver. Severe blockage for adults, children, infants. And this would be alone, as well as, I suppose, choking with someone present.
Someone that's present, right.
And the legal implications.
Right. So why don't we start off, we always kind of start our shows with a definition, and I'm sure people know what choking is, but conscious choking basically is when you're awake and you choke on something like a toy, a piece of food. It can be a lot of different things that people choke on, but something is blocking either your throat or your airway so that you can't breathe. And the airway, fancy name for the airway is the windpipe. So when someone says something's caught in my windpipe, what's happening is your airway's being blocked. Air can still get through oftentimes when there's a blockage, or say when you swallow a piece of food or drink something and you start to cough and choke. But if conscious choking isn't treated, it can progress into unconscious choking where the airway can get totally blocked. You're getting no air and oxygen in there, and you can become unconscious. We're going to talk a little bit as we do the show. We have some great footage on teaching people how to treat these, and we'll see what to do briefly if it turns into unconscious choking. But primarily we're going to talk about what to do in a conscious choking situation.
We will now look at the causes of choking.
Right.
And we do have a graphic that will be on screen momentarily, so as you go through this, folks can follow at home.
So there's a lot of things that can cause you to choke. Eating too fast, failing to chew your food well enough, or eating, a lot of times when we see with the elderly, eating with poorly fitting dentures. The dentures are loose, people start to chew things, they can't really chew them enough, and big particles will go down and block the airway. I've even seen cases where partial dentures have actually fallen into the throat and have caused the choking themselves. So that can be an issue. Drinking alcohol, even a small amount, can affect somebody's awareness. And so what happens is if you're drinking and eating, which often people are out in a restaurant or at a party, and they're eating and they have alcohol that they're consuming along with it, they may not be paying attention, or their awareness is affected by the alcohol. So they may not be chewing the food right, they might not be biting the right portion, and so that can be a choking hazard. Also, when you're out in a restaurant, oftentimes you're talking if you're with a group of people, so you're talking, you're drinking, you're eating all at the same time. And so this is where we can see the issue happen. Another issue is being unconscious and breathing and vomit. Someone who might be unconscious because of maybe drinking too much, or not even drinking too much, even if you got a hit on the head and you became unconscious, a head injury. If you're lying in a certain position, the vomit can go back in your throat, and you can choke on that. Someone who maybe drank too much, and when you're unconscious, you're usually still breathing. We're talking about the person who still breathing, but is unconscious, maybe lying on the ground from an injury, maybe a drug overdose, maybe an alcohol overdose. And if they're unconscious, what happens is, especially if you're on your back, your jaw loosens, the tongue can go back and block the throat. Also, if the person vomits, which they often do from either a drug or an alcohol overdose, the vomit goes back, and then that blocks the throat. So those both can be serious issues that can be causes of choking. Breathing in or swallowing small objects, a lot of times this happens in young kids. Toys, marbles, all different kinds of things that kids put in their mouth, especially real little kids, 2-year-old, 1-year-olds. It seems like everything that they pick up goes to the mouth. The biggest thing that we see the most often with young children, the things that they choke on, are things like grapes, because they're just the right size for a child to pop in their mouth and block an airway, and hot dogs. Hot dogs are really kind of the number one food that young children choke on. A hot dog, if you think of it when you take a bite of it, it's just the right size to block a small airway. So what we tell people is, if you're feeding young children hot dogs in the bun, take that hot dog and cut it right through the center lengthwise. So when they're biting, they're getting 2 smaller pieces or a tinier piece than that round piece that fits right nice in that airway and can block it. But that's one of the major causes of food choking in young kids. And also, we had talked about injury to the head and face. So if there was any swelling, bleeding, or deformity in that area, that can block an airway and cause choking too. So those are some of the things. There's many more, but those are the most common things that we see.
I just would like to revisit drinking alcohol. If someone has passed out, they're on their back, is it then wise to put them on their side?
Yeah, it really is. We teach, when I teach CPR and go further into conscious choking and unconscious choking, if somebody is the victim of a drug overdose, or they're drinking too much and they're unconscious but they're still breathing, obviously if they weren't breathing, you'd be doing CPR. But if they're unconscious and still breathing, there's a position that we teach to put people in. It's called the recovery position, where basically you turn the person on their side, and it helps to prop them with their arm and their knee so that they don't roll back over. But even if you don't know that position, rule of thumb is never put an unconscious unconscious breathing victim on their back, unless you're going to stay right with them and the ambulance is right there and you fear there might be a neck injury or something like that. On their back is a bad position, because again, when you're unconscious, the jaw gets very loose, tongue flops back. The tongue can block the throat, or if they vomit, that can block the throat. Same type of position that you would put somebody in if they were having a seizure, an epileptic seizure, that type of thing. So you always want to put somebody on their side. The stuff drains out on their side, and it's not going to go back and block the airway, hopefully. Next,
we are going to look at a mild blockage.
Right. One of the things that we like to make a point of when we're talking about choking, you have to know the difference between a mild blockage and a severe blockage, because the treatment is much different. So in a mild blockage, this is when you say take a drink of water and you start to cough, and you're coughing and you're coughing and you seem to be losing your air, but you're still coughing. As long as you're coughing or you can talk, it's considered a mild blockage, because we know that the air is still getting through. If the air wasn't getting through, you wouldn't be able to cough, you wouldn't be able to speak words. So you want to, if it's a mild blockage, you want to just stay with that person. You want to encourage them to keep coughing, because most of the time people will, in that process of coughing, get up whatever is blocking that airway, or if it's fluid, the fluid will eventually go down or come up, and the blockage and the coughing will stop, and the person will be okay. We worry when that person is coughing, 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 gagging, and all of a sudden the sound stops, and now the person is just can't seem to get any air in there. That's when it turns into a severe blockage. And most people, when they can't breathe, do the what we call the sign of choking, is when you take crossed hands and you grab at your throat, because most people, for some reason, it's kind of almost a thing that you do without thinking, is you grab at your throat because you can't breathe. It doesn't help you, but it's kind of what we consider the universal sign for choking. So you'll see the person clutching their throat with their hands. They cannot speak, they cannot cough. Usually they make no sound at all, or there's like a high-pitched wheezing sound. Oftentimes their lips will turn blue. The beds of their nails will turn blue. The skin gets kind of a grayish, ashy color. You can see this much quicker in infants and children than you can in adults, but you will often see those same symptoms in adults. And then you get that lack of alertness that can progress if you don't do something right away into the unconscious state. So you need to know the difference. Mild blockage, stay with them, encourage them to cough. Hopefully they can get it up themselves. If the noise stops, they start clutching their throat, they're not coughing, they're not making any sound, you're getting those color changes, then you need to know you need to do something right away or the person could die.
People will be familiar with, of course, the Heimlich maneuver.
Right.
And that's what we'll talk about next.
Right, and so when you get into that severe blockage, what you want to do is you want to do something called the Heimlich maneuver. And it actually started, it was originated from Henry Judah Heimlich, who was an American thoracic surgeon. He invented the technique, and he first published views in 1974, and it was in response to a restaurant owner who actually did the Heimlich maneuver, did the technique on a patron who was choking and actually saved her life. And so he published a paper, and from that point on, it has become kind of the rule of thumb thing to do with a conscious choking victim. So we use the Heimlich maneuver when we get into that severe blockage state. So if we can bring up the next visual, this shows the Heimlich maneuver in an adult and in a child. And basically what you're going to do, and we're going to see some footage on the sequence, but with an adult, you would stand behind the adult. The first thing you're going to do is, if the person is choking and they're usually clutching their throat, you're going to say, "Are you choking?" And if the person obviously can't speak, they'll usually just shake their head. You must ask them permission. Can I help you? Because they're a conscious person. You have to get their permission. We're going to talk about legal implications in a bit. So you say, "Can I help you?" If they shake their head yes, then you get behind them. You're going to put your thumb of your dominant hand inside and make a fist, and you're going to place that halfway between the person's breastbone and their belly button. That's the area, and we'll see some footage of this. Your other hand goes on top of it, and you can see it right on this visual it shows, and you're going to do quick forceful thrusts inward into that person's stomach, and hopefully that will be enough to propel it out. With a child, you can, if the child is small, you can kneel down behind the child, and your placement, your hand placement is the same for the Heimlich maneuver. So that's the rule that we usually use with adults and children. With infants, it's a little bit different. Obviously, infants, oftentimes they're not standing yet, so you can't stand behind them. And you don't want to do that same maneuver because the force that you're going to be doing it with could injure internal organs. So if we can bring up the next visual, the infant conscious choking maneuver it encompasses two steps. The first step is you first pick up the child, you put the child on its back on your forearm with your arm stretched out, and you turn over the child, and so that the child's facing down, the head is facing down, and then you give 5 quick back blows, which is what you see here. And then if you see the next visual, you turn the child over, and then you're going to give 5 chest compressions or chest thrusts. And you're going to switch off. You switch the child from one arm to another to do these until something comes up, and you try to sweep the mouth out in between. We'll show the exact maneuver in a bit, but basically when you're doing the back blows, you're using the heel of your hand and hitting down, and when you're doing the chest thrust, you're using 2 fingers, and the placement is right between the nipples on the child, maybe a little bit below that nipple line, just the same area as if you were going to be doing CPR on that child. So we talked about adult and child, you're going to use the Heimlich maneuver. Infants, you're going to use this back blows and chest thrusts. And then on a pregnant woman or somebody who is obese, obviously you're not going to put your hands in the same placement you would with an adult. If we could bring up the next visual, you'll see that basically the hands go up higher right at the breastbone, the end of the breastbone. And you can do your chest thrust that way. Yes, it's higher than what you would normally do for the Heimlich maneuver, but you don't want to injure the baby. If it was an obese person and you couldn't fit your arms around their belly to get in the middle, in between the belly button and the breastbone, then you would do this option too, which is do those thrusts right at the breastbone. And it's oftentimes sufficient enough to help that person. So different kind of maneuvers for different situations. And we will see when we see the footage, there's also a way of doing the Heimlich maneuver on yourself if you're alone and no one's there to do it for you when you're choking.
We will now turn to a severe blockage. And we should mention that we had quite a number of actresses help us out.
We did, and you'll see footage of a severe blockage. The biggest thing, like we said, when we talk about severe blockage, that's when you get into the Heimlich maneuver or the back blows for the infant. One of the things that you want to remember to do is you need to call 911. Even if somebody is just in a mild blockage and just can't seem to clear it, they're still talking, they're still breathing, they're still coughing, but they just can't seem, that you think that the situation might get worse. You always want to call 911. Get somebody with, get an ambulance on the way. You don't want to be doing this by yourself for long periods of time. You don't know if you're going to be able to relieve this blockage. So you want some professionals there that can help you get this person to the emergency room as quick as possible. And you also want to make sure that after you do the Heimlich maneuver, if you are lucky enough to get whatever's in there unstuck, the person should always be seen by medical personnel, because you don't know what kind of damage has been done in there, either through doing the maneuver or whatever was stuck in there can cause some damage to the internal organs, to the airway, can cause some swelling. So you always want to encourage the person to go with the ambulance, even if whatever's in there is gone. One of the most important things when a person gets into a severe blockage is you want to make sure that a lot of times what people will do is they'll get nervous and they'll get embarrassed, particularly in a restaurant situation. They start to cough and they choke and they run into the bathroom. Follow them into the bathroom, because many, many people have gone into this situation and have died in the bathroom because people haven't gone in there. So that's something that's important to do.
And we will see all of this in just a moment.
In just a moment, right? And then the last thing I think we want to talk about is legal implications. A lot of times people are afraid to help. They think, well, if I do it wrong, I break a rib, I'm going to get sued. There are a couple of things that you need to know as far as legal implications. Consent. You need to have permission from a conscious person. So that's why I said the whole scenario is, are you choking? Can I help you? If the person says no, you cannot help them. And sometimes the only thing that you can do is call 911, okay? So that's consent or permission, and a responsive adult must be able to give that express consent. But let's say the person becomes unconscious and they can't give consent, then you can go ahead and do what you need to do as far as taking care of them, and that's called implied consent. Implied consent means that you can, if they were awake, they would probably say, yes, go ahead and help me. This would also come into play, let's say you followed that person into the bathroom and they were choking and you said, can I help you? And they said, just shook their head no, and then they became unconscious. Implied consent kicks in, and then you can help them even if they said no in the beginning. Implied consent also comes into play if there's a child and there's no parent or guardian with them to help. Implied consent means that you can go ahead and help that child. So you have to use your judgment with that. Another part of legal implications is something called the Good Samaritan Law. Most states have some type of a Good Samaritan Law. Massachusetts does. And basically what it does is it prevents someone who voluntarily tries to help somebody from being sued if something goes wrong. So let's say you're doing the Heimlich maneuver, you break a rib, it pierces the person's lung. They can't sue you for that because you were doing what you were taught to do. You didn't go above and beyond, and you did it for the right reason, okay? When you can get into trouble is, let's say you had a person choke. There was two people choking, okay, at the same time. One was a poor man and one was a rich man, and you decide that you're going to go help that rich man because he's probably going to give me a monetary reward. That's unethical. That's not doing it for the right reason, so that could be something that you could get in trouble for. Or if you went above and beyond what you were taught. Let's say someone was choking, you did the Heimlich maneuver, it wasn't working really well, so you decided, you're in a restaurant, you decided to take a steak knife off the table and make a tracheotomy so that they could breathe. You went way above and beyond what you were taught to do, so then you could be liable for something. Some states, their Good Samaritan Law even covers doctors and nurses and medical personnel. Some don't, so you need to check whatever state you're in. But if you're a voluntary rescuer and you are a lay rescuer, meaning you're not a doctor or a nurse or an EMT, you are usually covered by the you are always covered by the Good Samaritan law. So don't hesitate to help as long as you're not going overboard.
How prevalent is that law throughout the country?
I think actually most states in the country have it. I don't know of any state that doesn't. And so far to date, in the whole United States, there has never been a successful lawsuit that has implicated somebody for trying to help either with CPR or with doing the Heimlich maneuver for conscious choking. So I think it works.
We should mention that obviously time is of the essence during this situation.
It really is. The thing is that don't be embarrassed to run into, if you're chasing a little old lady into the ladies' room and you're a guy, they might stop at the door and say, no, I can't go in there. This could be a matter of life and death. And sometimes doing the Heimlich maneuver, when we practice it and we show it, it doesn't look too difficult to do, but you'd be surprised how much and how forceful you have to do this. I've talked to firemen who said it took 4 or 5 of them to get a chicken bone stuck out of a little tiny 100-pound lady's airway, and they had to take turns to do it before they did it. So it looks like it would be simple, and sometimes it is, but sometimes it isn't. And if you're doing it on somebody that you know, like one of your kids or one of your parents or a loved one or a friend, then the nerves kick in and the adrenaline rush kicks in, and so you have to take that into consideration. It's always easier, I think, for most people to do these kind of maneuvers on somebody they don't know. But if it's a person that you know or a loved one, or if it's a child, then the nerves kick in. So you just have to kind of stop, take a deep breath, think about what you need to do, call 911. Get that help on the way. You don't want to be doing the Heimlich maneuver for 20 minutes by yourself with no ambulance on the way. And just make sure you're not going above and beyond what you were taught to do. And it's amazing how many lives are saved by this procedure. It's very, very important.
Next, I believe we will take a look at some video.
Right. We have some footage, and actually the footage, in the footage, I have 2 nurses who are bachelor degree nursing students doing some clinical with me, and a friend of one of the nurses, and my niece and her daughter, and we put together a video to show you exactly the different things. So if we could bring up that video, and I'll try to talk through it and let you know. So this is adult choking, and she was choking and coughing, and they were encouraging her to cough, and now you see the hands around the throat, and now we know that that's a severe blockage. So Mary here is behind her. She's getting her hand placement halfway between the breastbone and the belly button, knee behind the victim's knee in case she becomes unconscious, and she's doing those inward thrusts, and you have to be real forceful. And that shows the knee placement, so that if the person becomes unconscious, they just kind of slide to the ground. There's the hand, how you put your thumb inside the fist, and the other hand goes over, and that would be placed, again, halfway between the breastbone and the belly button. If the person became unconscious, your hand placement is the same as if you do CPR. So you'd lay the person down in the back. This is a child and an infant. We just saw a quick with the child that someone is doing and kneeling down behind them, and with the infant, this is the back blows and the chest thrusts that we had talked about. And here's Mary actually doing it sitting down in a chair, because some infants might be too heavy for you to pick up and do it, so you can do it sitting in the chair. You have to make sure that the head of the infant stays down, so if something comes out, it's not going to go back into the airway. And then you can see here that every so often you make a sweep of the mouth to check that. Here Helen is eating something, and this would be what you'd come up in a restaurant situation. You see her choking, and the important thing, are you choking? And now she's stopping, she can't breathe, and she's clutching her throat, and we see someone else coming over and calling 911. It's important to call 911. Get the ambulance on the way. It's important to follow that victim to the ladies' room like we see here. Don't be embarrassed to do that, because you could save that person's life. We talked about doing it on yourself. If you're choking and no one's there, you can lean over a table or lean over a chair, and that will help you do the Heimlich maneuver on yourself. And actually, when you're leaning over, you're actually pressing in that same area halfway between your breastbone and your belly button, and just thrusting yourself on whatever. It could be a counter, it could be a chair, it could be a table. I actually did this once on myself. I had eaten actually a donut hole, a munchkin type thing, and it stuck in my throat, and I was by myself, and I did it against the counter, and it actually came out. It works. You get very nervous when you can't get air in that airway. So you have to kind of keep you cool and think, what can I do to help myself? Important things, very important things.
And we should, of course, thank the assistants we had for this particular episode.
Right. So we had Patty Gannon and we had Mary Newcomb. Those are the two nursing students. My niece, Jennifer Jones, and my great niece, Eva. It's Jennifer Magnell and Eva Magnell. And then Helen, who was Patty Gannon's relative and friend. And I think Helen did a wonderful job being the victim for a good portion of the video. So we thank them all for being part of this.
As we close, naturally, we do want folks to be able to get in touch with the Quincy Health Department.
Right.
You do have a phone number that folks could reach you at?
Right. You can call me directly at the Quincy Health Department. It's 617-376-1286. That's my direct line. Be happy to talk to you if I'm there. Leave me a message. I always try to get back and do my calls the same day or the next day. So.
And the City of Quincy website.
Right.
The Quincy Health Department has a tab on that site.
Right. And the city website is www.quincyma.gov. If you click on, you can get onto any of the city departments, click on the health department. We have lots of information. It changes periodically according to different issues that are pertinent at the time, and all our contact information is there. So check out our website. It's really good.
I should mention, I believe I did mention, that this particular topic you and I discussed and thought it would be a good topic to cover. I guess we're surprised that we hadn't covered this topic in the past.
Right.
But that brings me to suggestions from viewers.
Right.
Often we get suggestions from our viewers.
Lots of times, actually. And a lot of our shows are from phone calls to either Quincy Access TV, or to me at the office, or people that are coming into the senior center and say, my cousin has this, or my husband has this condition, or could you give me more information about this? So they give us some really good suggestions of things to do. And I also get a lot of calls from people who have seen shows and want some written information or some more information on that particular subject. And I'm always happy to send out information and direct you to things that might help you with yourself or one of your family members. So.
Well, as always, I want to thank you for coming in and
you.
talking about this particular topic today. And we will have to have you back at a different time, a different day, on another topic.
Great. Happy to be here.
Thank you. We're happy to have you.
Thank you.
Thank you for watching FYI, the Quincy Health Department. I'm Mark Crosby. Please continue to watch Quincy Access Television for more locally produced programming.